of lies and misinformation of coronavirus. So Truth Lies Shenanigans brings you the truth. Stories directly from the people that lived it, frontline workers and survivors. This is the COVID Chronicles. Today we have with us Dr. Marjorie Simpson, a board-certified geriatric nurse practitioner with her PhD from the University of Maryland School of Nursing. She is currently the Director of Nurse Practitioner Services with Expanding Medicine, treating patients in skilled nursing facilities and assisted living facilities in Maryland. She is an adjunct faculty member at the George Washington University School of Nursing and Stevenson University. She lives in Northern Maryland with her wife, Lisa, her son, Liam, and Dr. Simpson is also certified open water scuba diver, enjoying running, cycling, and making fart noises with Liam. She is celebrating 30 years of nursing this year. Thank you so much for joining us for the COVID Chronicles segment, Dr. Simpson.
Thank you. Thank you so much for having me.
All right. So let's just get started. Can you tell us a little bit more about what you do currently and your background? Anything that we might have missed?
Yeah, I'm a geriatric nurse practitioner. I started out as a registered nurse, and early in my career, I started working in nursing homes, skilled nursing facilities, and just really loved taking care of older adults. Really loved being in that environment because you get to know your patients. In the hospital, you only know your patient for a few hours or a few days, or if there's COVID-19, maybe a few weeks. But in the nursing home, we know our residents for years and years and years. And I just always loved that. I became a nurse practitioner and continued to work in skilled nursing facilities. I work for a small practice in Carroll County, Northern Maryland, and there are 3 providers in our practice. We're in 5 nursing homes and I think 4 or 5 nurse assisted livings. When the COVID pandemic started, we didn't want to risk that all 3 of the providers would get sick or be exposed to COVID-19 at the same time. So we used to rotate between all of the buildings, but we stopped rotating. And I have been in 2 facilities since the pandemic started. One of those facilities was hit pretty hard with a COVID outbreak.
Oh boy.
The other facility has been fortunate and hasn't had any COVID patients.
That's awesome. So of course we're aware about the initial outbreak in Seattle. That was all over the news, ravaged that nursing home. So in that particular nursing home where you had the COVID outbreak, what was going on? What did you see?
Well, we saw patients who started having symptoms, and there were about 6 patients who at the same time developed a cough or a fever. And we had just gotten some testing kits from the health department. Early in the pandemic, nobody knew where to get testing kits from. Nobody had them. We were fighting to get PPE, and the health department had helped us out. So we tested those few symptomatic patients, and 4 out of 6 were positive.
Wow.
And got very sick very quickly. So what we have to do is we have to separate the sick people from the healthy people to prevent it from spreading around the building. And we had to create a COVID unit with plastic zipper walls to try and contain the virus and keep the virus contained to just the people who were already positive. That was sort of our first wave. And shortly after that, we had multiple patients on the first floor on one unit who started to develop symptoms, fever, cough. And in Maryland, Governor Hogan had developed the nursing home strike team, to help nursing homes in a COVID outbreak, and the strike team came in and tested the whole building.
Wow.
Um,
Wow.
and we, after that, had another large number of residents who tested positive for COVID.
Wow.
It
So,
just progressed. Go
so
ahead.
you mentioned PPE, and I know there is you did a video and you posted about PPE shortages that were happening, and it kind of went viral, and then I think you were interviewed on WBAL about it. I'm just going to show a really quick clip, and then I want you to just tell us what was going on.
Officially isolated myself from my family to protect them. There's a really big disparity in how personal protective equipment, or PPE, is available. And if you have any N95s or face shields, PM me and give them up to the healthcare workers. So if it gets into that building, it's going to be really bad. A lot of people are going to die. They can't get face shields. They got credit cards. I will buy them. They will buy them from you.
Yeah. So tell us what was going on.
Gosh, that is just me absolutely frustrated. We could not get PPE. And, back in March, the whole world needed the same thing. Everybody needed face shields. Everybody needed N95 face masks. And the nursing homes really struggled with that because the hospitals are part of these, big medical groups, and they have much stronger buying power than nursing homes do. And we were trying to figure out how to make face shields. And I had so many people mail me face shields. Dr. Lim, a dentist in Montgomery County, his office was closed, and he had called all of his dentist friends and collected PPE and brought it to me, and I was able to deliver PPE to 9 different nursing homes. So in the middle of a pandemic, I'm also struggling to try to get PPE out to help people.
That's amazing. Yeah, actually, I saw one of the videos. I saw the WBAL interview, and you were actually trying to make a mask. Is that what you were doing?
Yeah, somebody had seen something about making a face shield using a headband and a page protector, and I was excited. I was like, okay, I'll make headbands. I'll go get some, and I made it and I put it on, and it was horrible. Nobody could work with that on their face,
Right.
and it was just terrible. But thanks to a lot of donations that came in, we were able to get PPE. And then as supply chains started opening up, that has not been as much of a problem over the past 2 months than it was initially when the pandemic started.
All right, Lizzie. Seem to be muted, Lizzie.
Not good. Okay, so Dr. Simpson, I have a question about awareness as it relates to your patients in the nursing home. Like, how did you get the word out to them about what was going on? Were they made aware by, a big conversation? Did everyone communicate together? Or were they aware? Did they understand what the pandemic was like outside of the nursing home and what was happening across the country and why they were perhaps getting sick?
Well, at that, early in the pandemic, there were a lot of news stories. That's when we were seeing stories from New York with, refrigerator trucks filling up with dead bodies. There were, it was very well known that this was something that could kill people. And I started very early on, before we even had COVID in the building, talking to my patients, or for those patients who have dementia and a family member helps them make decisions. I started talking to them about, okay, there's a possibility that we could have the virus in the building and that you could get sick. And what would you like to do? And a lot of my patients said, I don't want to be on a ventilator.
Mm,
If I get sick, I want to be here. Can you make me comfortable? And I said, yeah, I can make you comfortable. I had some patients who said, yeah, I want everything done. And so we had that plan going in to the pandemic of what we were going to do.
So I
And
have a question.
Lizzie.
go ahead, Jim.
Okay.
Go ahead, Jim.
I had a question to piggyback on that question. I have an uncle who's in hospice down in Florida, and one of the issues with him, one of the issues that I've heard about is visitation with family members. Um,
Hmm.
how have you guys set that up, and have you seen any decline in patient health that you think is like a result of lack of that, or anything along those lines?
Yeah.
Question.
Absolutely. It's been really, really hard for family members who can't come in. It's been really, really hard for a lot of our residents as well, particularly those residents who have dementia and they're used to a family member coming in a couple times a week or maybe even every day and maybe sitting with them for a meal and helping them with a meal. We've had some residents who became depressed and who had some weight loss. And we're very fortunate that we have a psychiatrist and a psychiatric nurse practitioner who are in the building every week to help provide psychiatric services to our residents. But that has definitely been a challenge. People, you really, really miss having that contact with their family members. Now, they've done a lot of Skype visits with family members that they've taken the tablet around, but it's not the same.
Yeah, of course not. Yeah. What about your staff? Like, what's the protocol or what's the daily routine for your staff? Like, are they quarantined in the hospital? Are they allowed to go home? How does that work? And how have they been affected personally?
It's been very challenging for the staff, and a lot of the staff members are moms, and they worry about taking this home to family members, or
Those gonna be
maybe they have
relentless.
a family member who's elderly or has multiple comorbidities that put them more at risk. And the normal routine now is anybody who comes in the building has a mask on, and then a full PPE if we're on the COVID unit with eye protection, face shield. We've had the white jumpsuits, isolation gowns, everything to try and protect our staff as well. And, there have been in the state of Maryland 11 nursing home staff members who have died from COVID
Wow,
19.
staff members in
And
Maryland.
Wow.
So frontline
Yeah.
workers.
Wow.
yeah, and
Wow.
I think that people have forgotten that the nursing homes are the front line too. And most of our residents who contracted COVID 19 stayed right in the nursing home and never went to the hospital. We were able to treat them. Those, who were not very sick were able to recover in the nursing home. Those who were very, very sick and did not want a lot of aggressive measures, we kept them in the nursing home, and I ordered morphine and made sure that they weren't suffering.
Wow. Jam.
Wow, that's amazing. What has been your response as someone who is on the front line? Remember in the early stages, I would say like March, April, May, you had a lot of pushback from the government or a lot of pushback from people who didn't believe this virus was a hoax. Or who believed that this virus was a hoax, or believed that, okay, well, it's only affecting the elderly. So we can sacrifice them. It's not that big of a deal. Like, what was that like for you to hear that coming from so many different corners?
It's really very sad to me, and this is a country where a lot of people do not have a problem with ageism and thinking, well, they're old anyway. Well, that person was on hospice anyway, and then they died of COVID. What's the difference? The ageism, I think, is a really big problem, and there's a stigma associated with nursing homes. When people hear that patients die in the hospital from COVID-19, they don't blame the doctors and the nurses. They blame the virus. When people hear that a nursing home patient died from COVID-19, their first thought is that facility must be a terrible facility. Those staff members must be absolutely terrible. They're not washing their hands. They're not wearing PPE. And that couldn't be the furthest from the truth.
So I have a question in that vein of the last question. So now our current presidential administration has a habit of not telling the truth and flip-flopping on things like wearing masks, reopening the schools, reopening localities. As a medical professional, do you feel that this pandemic has been politicized for personal gain? And do you think this had an effect on the spread of the virus itself?
Absolutely. I think that a lot of people have died because of Trump and his unwillingness to address this pandemic appropriately. And a lot more people are going to die as well.
Jam, did you have a question?
I do. I have several. First off, the strike team. I'm interested in the strike team that came through. How often does that work? How does that work in the state of Maryland, as you understand it?
Governor Hogan set up this strike team of nurses and doctors, and there were actually nurses that came from all over the country to come and work with the strike team. So if there was an outbreak in a building, a nursing home is not set up to care for 20, 30, 40, 50 sick patients at a time. If they needed extra staff and they didn't have enough staff to run the building, the administrator could call and they would send members from the strike team over. And it absolutely saved my one building. There was an amazing nurse there from North Carolina who was an ER nurse and came to Maryland to work in a nursing home, and she was fantastic during the outbreak. We were able to call them. It was temporary, but it was extra hands, and that model in Maryland was really, really successful and became a model for other states as well.
Wow.
Yeah.
So my other question is a totally different swerve on this. I want you to look into the future and tell me stuff I know you have no idea about. No, it's a different type of question. So I have a thing, like there's always talk about the difference between a rural existence and like an urban city existence. And so as a person who works primarily with nursing homes and smaller facilities along those lines, with that same sort of difference, I know there's like the idea that COVID is much easier to spread in an urban environment. But as you have those environments within a more rural area as compared to where we are sort of here on the East Coast, do you see any major differences? Do you see any difference in approaches? Anything along those lines that you could share and talk about?
In Maryland, I know that there have been larger clusters of COVID in urban locations, and that also was reflected in the COVID-19 rates in nursing homes. There is a website. Every week they update the website on Wednesday with all of the COVID numbers in each nursing home in Maryland. And some of the larger facilities in Baltimore just had terrible, terrible COVID outbreaks that started back in March and are still continuing now. Not just with large numbers of staff or residents rather who are positive, but also large numbers of staff members as well. I've never seen anything spread like this before.
Lizzie,
Um,
Lizzie, I know you had a question, and then I want to get to some online questions.
Yeah, I was going to get to an online question
Okay, go
from
ahead.
before. So, one of our guests or followers had mentioned or asked the question about stabilization. Like, we are here at August 16th now. So, what does your facilities look like now? Have you guys stabilized? Are you on the downward spiral as it relates to the virus? Or is it still some type of uncertainty, especially as we get into the fall and the possibility of a second wave coming on?
And that question comes from Ripco.
So, my facility that had the outbreak currently does not have any staff members or any residents who are COVID positive.
Okay.
And it is a huge relief. I'm hoping that we stay that way for the next few months. The most recent research is showing that people who contract COVID 19 will carry the antibodies for about 4 months.
Hmm.
And then the
Okay.
antibodies really start to drop off. So my big outbreak was in May.
Okay.
I really expect by October, we could be seeing another wave going through.
Wow.
I will say this, we're doing things differently than we were early in the pandemic. And, everything changes every day. And right now, it is mandated by the health department that every single nursing home staff member is tested for COVID 19 once a week. And if any
Okay.
staff member comes back positive, then they have to test the whole house. So
Mhm.
I'm hoping that this helps us identify people who are possibly asymptomatic carriers a lot earlier and get them in quarantine so that we can protect our nursing home patients.
Okay.
Are
I have a
family members now allowed to visit your facility?
good question.
If in Maryland, if your building has been COVID free for I think it's 14 days with no positives, you can have limited visitation outside. They
Okay.
have to schedule appointments. They still have to social distance, and it can only be, I think, 2 people at a time. But yes, we are starting to do that. I also want to say that we have been allowed to allow essential visits from family members. If I had somebody who was actively dying, we could absolutely approve the family to come in. They were screened just like the staff members. Their temperature was checked. They had to wear a mask. They had to wear PPE. But nobody died without family member coming in if that's what they wish to do.
So I have a question. I do have another online question as well. But so in the nursing home, I'm sure, unfortunately, you're pretty used to seeing people passing away. But what is different about what COVID looks like? What does that look like to you? Because I'm hearing some pretty major horror stories about what that looks like.
We have had, I have had residents who were very fortunate and were asymptomatic and positive and never had a fever, never had a cough. Um, I have had patients who were symptomatic, but it wasn't that bad. Maybe their symptoms lasted for a week. And then I've had patients who absolutely horrific. And I remember one little lady, oh gosh, she was just really uncomfortable, and her sister was making decisions for her. She didn't want her to be intubated. She just wanted us to keep her there and keep her comfortable. And we were just giving her morphine, which helps that sensation of air hunger. And we let her sister come in and say goodbye to her. And her sister just took one look at her and just like almost collapsed. And, I had forgotten how shocking it is for someone to see a COVID patient in that acute respiratory distress for the first time. And it's absolutely horrible. I have had trouble sleeping. I've had nightmares about it.
I'm sorry.
Well, and just before Neo goes to the next online question, that makes me ask you, how are you doing?
Yeah.
I'm doing okay. I
Good.
am not ashamed to say that I did start scheduling appointments with a therapist just to do a little check-in to help me cope with the extra stress. I'm also
Mhm.
working more hours than usual, and that's been very helpful. I have, an amazing family and amazing friends who are supportive, as well as running and staying active and trying to keep some normalcy, as much normalcy as possible in my life. Thank you.
And I'm sure your
Good.
family is a big part of that. Um,
Yeah.
so Lauren Fowler Flowers says, "Do you think that staying COVID free is a reality, especially as restrictions are loosening?"
No, no. I think that I'm going to speak just to the nursing homes. Any nursing homes that haven't had a COVID outbreak and they think they're safe, they've made it to the other side of COVID and they're never going to have a problem. I think that's really not realistic. As we open things back up, in many places, opening things up maybe a little too early. A lot of people with attitudes that it's fake, that COVID-19 really isn't a thing, and engaging in dangerous behavior. I think until we have a vaccine, it's going to be a problem.
And that's part of the reason we wanted to do these COVID Chronicles, is because there's so many people saying this isn't real. Another question online is mental health services, are they available for your staff for this?
Yeah, actually, the
That's from
state
Dina
of
Lambert.
Maryland set something up for nursing home staff where they can get mental health services at no cost to them. And, it's there is this bereavement component. I have lost some of my patients who I have taken care of since 2007.
Wow.
Um, Nursing home staff, we love our residents. They are like our family, our parents, former soldiers, my Marine who did 2 tours of duty in Vietnam. I love these guys so much. And to have so many of them die in such a short period of time has been very difficult to deal with.
All right, Jam, we're
One
about
last,
to uh,
just one last point,
go
very
ahead.
quickly, because we're talking about the idea of death and how death has run rampant because of this disease. But I also think that to get the death toll numbers out there has also been a curse, because a lot of people, and Mike Winter brought this up in his comment online, a lot of people think, okay, well, you didn't die, so you're good. It's not that big of a deal if you didn't die. But then you're talking about, again, these are nursing home patients. These are our elderly. Like you said, a lot of our veterans. So, yeah, they may not be dying, but they're still suffering if they have this disease. So, can you just talk about that a little bit, about the suffering that goes on? Not
Yeah,
necessarily death,
And I've
but
heard
the
something
suffering.
about post-COVID symptoms.
Yeah, yeah, definitely, yeah.
absolutely, absolutely, and yeah, I mean, flu-like symptoms. I mean, who wants to have flu-like symptoms? Who wants to feel sick and the aches and pains that come with this. One of the things that we saw, particularly on our dementia unit, was I knew there was a problem when I went to the unit at breakfast time, and the nursing assistant had just collected all the trays, and she said, all of this food is being wasted. Nobody ate. And I was just like, whoa, wait, okay, what's going on? And we tested the whole unit, and almost the entire unit was positive for COVID.
Wow.
So we have had a lot of weight loss, and even with, trying to give insurance supplements. People who aren't elderly will lose weight on COVID. And we have had people who just have never been the same. They just never quite bounced back again. They're doing in our facility aggressive rehab. Everybody with COVID gets physical therapy and occupational therapy. Even with that, people who were up and walking around before are not walking now. I've had a lot of people who just never bounced back. Never bounced back.
All right, Jam, I want to give you the last question.
Okay, it's two. They're real quick. The first one is, I hope have you introduced your son to Pee Wee Herman's Big Adventure? Because Large Marge in your name, come on. Secondly,
You didn't notice Marge Simpson?
secondly, there is a show that's been running for several years. Although the hair color is different, I would hope you guys have a chance to sit down and watch. Are you a fan of either of the Simpsons or Pee Wee Herman's Big Adventure?
Both.
Oh,
Those are your final questions.
I just want to go over some of.
The Big Shoe Dance, Pee Wee Herman Big Shoe Dance is my go-to karaoke song.
right.
Tequila. There's only 3 words in the whole song.
So final comments online. Dr. Marjorie, thank you. This is from Beverly Willis. Thank you for your candor and your passion. Robin Johnson says, I know how stressful this time is. She's also a veterinarian, so she's talking. She has double caseloads. And Lauren Flower says, thank you for all that you do. So
Yes, thank you.
we have a ton more questions, but we're definitely out of time. I truly want to thank you for joining us to share your story and for putting yourself at risk to help protect people, to protect the public. So we truly thank you for that.
Thank you
Thank you so much for having me on your show. I really appreciate it.
All right, thank you.
Tequila,
All right.
tequila.